Not connected. Oh, there we go. We're on there.
Oh, we made it. Boy, that was a fight.
That was a fight for technical difficulties.
Yeah, so that's what's going on. Hi, it's Susie and Matt, and this is Suzilla. Welcome aboard to Wenatchee Insurance. Where we do insurance for you name it, we can insure it with the exception of pets right now.
That'll change after January.
I know.
That's one.
I know. That's it. Hence the right now disclaimer. So that's Matt. I'm Susie, and this is Wenatchee Insurance. Also, we also are Susie Health Solutions, where we help people with health insurance. Pretty much, if you need it insured, we can certainly take a strong swing at it.
Okay, and we're going to get into it today with the big one.
That's a very huge change for Washington State. Washington State applied with the Affordable Care Act for what's called a 1332 waiver.
Yes.
Now, correct me if I'm wrong, but a 1332 waiver is when the state that's asking for it asks the federal government, who's in charge of the Affordable Care Act, can we do something different than what's in your rules? And
yes, but basically how it works, there are different programs out there. Medicaid is one where they've done the most experimental stuff, the most progressive. 20, 30 years. They said, hey, we're going to do this cascade givings, Washington State tax credits.
Right. So there's the federal tax credits, the advanced premium tax credit, and the Cascade Care Savings, which is a Washington State only credit that kicks in if you're under 250% above the federal poverty level.
And we've seen that, and that's worked pretty good. And that part of the 1332 waiver was they said, okay, we want to get our undocumented immigrants access to health care.
Correct. So what they did is they said, can we do this? And the Fed said, if you can put it together, you can do it. But don't expect us to help pay for it.
And this was set up a long time ago, 12 years ago, when the Affordable Care Act was first put together. There were some crafty legislators that in process said, hey, you can't have undocumented immigrants shop for health insurance on your exchanges.
Right.
That was put into the Affordable Care Act.
Right.
This 1332 waiver takes that negative portion out.
Right. It created an opportunity for people who are not documented residents of Washington State to get health insurance through the Washington State Health Exchange using Washington State Cascade Care credits or paying full price for the policy.
Yeah, and they the exchange has put together some real craftiness in putting this together, because one of the first things that we have to deal with is the public charge.
Right.
Now, the public charge was invoked by the previous administration, and they said, hey, you know what? If you use any sort of safety net services, you can't get citizenship.
Yeah, which is weird. But that's what it is. It was another barrier to citizenship.
It was another barrier to citizenship. It was an extension of what they call means testing. They just make it really mean. And we've been fighting that that rumor for a couple of years now. And I will have to say rumor. And so, as you know, since we're one of those groups that help large populations of immigrants, we have to assure them on a regular basis that yes, your information is secure. And we do that. We've done that for years, and the state's kind of catching up with us, and they're saying, okay, well, what we're going to do is, since we're not going to run using ITINs, we're not going to run using social security numbers. We are going to limit the information that the feds have, and it stays here. So data is safe.
Yes. And I asked specifically during a training session yesterday, what kind of extenuating circumstances might the feds or a federal agency ask for this information? Because there's a possibility they may ask for that. And they replied that it had to be a court order and run absolutely through the state's lawyers before they'll release that information. So it's not, oh, hey, Washington State, can we have this guy's address and phone number, without huge amounts of legalese going on?
Yeah, so it's gonna take a serious fight to get information.
Right. So if El Chapo came to Washington State, yes, he could apply for health insurance. Yes, they could get it. If the feds catch wind that El Chapo's in the state, then they have to go through a court order and all kinds of lawyers and stuff to get his location. And so your average person, not going to be even a blink of an issue, because the feds aren't going to know that you're in Washington State by this program.
And I had we're full of dispelling myths. One of the myths, and was that someone that didn't have their green card, their 551 card, wasn't eligible for benefits. And we had a former navigator tell us that. We're like, no, they are eligible for benefits. They just are not eligible for Apple Health.
Right. Our Washington State's Medicaid program. If you have a 551 card, you're a legal resident, but you're under but you haven't been here for 5 years.
Correct.
What you can happen is you can apply for health insurance. You can't get Medicaid, but if your income's low enough, you get the Cascade Care stuff. You get a state discount. You also get federal discounts.
Yep.
So you get a super low price premium, and you get the cost sharing benefits, which reduces your out-of-pocket expenses. You get about as good a policy as you can get without actually being on Medicaid.
And July 1st of next year, the people who are in the system,
in that setup,
in the new health insurance, regardless of immigration, will be eligible for Apple Health.
Just overall Apple Health. Exactly.
They'll be on a first come, first served basis.
Because they have a limited financial pool.
Correct.
It's big, but it's not enough for everybody necessarily.
And by the estimates, and these are the state estimates, about a third of the people that apply for this program will be eligible for that program.
Exactly. So if you're in the system already, you've got the chance, and you're in that 138% above the federal poverty level or below, which means you're very broke.
Yeah.
You're going to go directly into Apple Health and not have to pay any kind of premium.
After
July 1st. Exactly. So, but if you can get in the system and squeak through on the dirtiest, ugliest, cheapest plan you can for half a year, you should be on Apple Health. After July.
Now, there are groups of folks out there that are like, hey, what about the Dreamers?
Right. The DACA recipients, the Dreamers, that has been a thorn in Matt's side since day one.
No, it hasn't. It
bugged
started
ya.
in 2017.
Okay, day 3 then.
Up to 2017, Dreamers and DACA were able to purchase plans using the Healthplanfinder.
Yeah, because they had an ID that worked.
The administration there, the Congress got together and said, hey, you know what, we're going to change the rules here and kick them all out.
Right.
And now I saw these letters in person, and it was horrible, because it's like, well, yes, you are here on status. However, you are not eligible for health care.
Right.
Was the basics of it. And it was really horrible to see these sorts of things. Now, the Dreamers and DACA will be able to purchase, and they will get state credits for this first part. Now, it's in the works that we're going to see another rules change, and those Dreamers will be eligible for federal credits when that rules change occurs.
Right, and that's hopefully next summer.
Yes. So yes, immediately DACA recipients can get health insurance using this plan starting November 1st, and the plan to start January 1st. they'll get basically partial credits until the feds kick in and say, oh yeah, we're catching up to you.
Mm-hmm.
So yay, finally, because that's one of those ones we shouted about. There's only about 800,000 people that impacts across the United States.
It's still a lot of people, but there's not a ton of them in Washington State. I don't know how many dreamers are in Washington.
It's hard to say.
But it will affect 800,000 people across the United States next summer. Definitely. We can get them in the system, this year for 2024, and it'll just make things that much easier for them.
Yeah, this is one of those things that yes, if your residency status changes, then you'd click over and you'd get the federal tax credits.
Exactly. Well. Also would create a special enrollment period where you might be able to shop for a better plan because you'll have the federal credits and you could probably afford a better plan.
Now, one of the things is we are only dealing with state credits.
Right. And we don't know how much the state credits are going to max out at this year. They've got an estimate, but we don't really have those numbers probably until mid-October, maybe the first part of November.
Now, you're eligible for tax credits up to 250% of poverty.
Right. If your income is higher so you've got your poverty level, and below that you're on Apple Health. Above some people are on Apple Health. Above that, you've got up to 250% above that percentage. So almost 2.5 times that dollar amount is what your income could be. If you're anywhere in that sweet spot, you'll get those Cascade Care state credits to help pay for your monthly premium.
Now, it's based on a household income.
Correct. Household income and household size.
And we don't want to know about aunts, uncles, grandmas, and grandpas.
No, we want to know who's on your tax return.
Again, we don't want to know because there are some that put the aunts, uncles, grandpas on their tax return. Don't be doing that. We need the actual household.
Right. Mom, dad, and kids.
Or two moms and kids.
Or mom, and kids. Or dad, and kids. Or right.
And it's really important. Here's the thing. Because we've seen this time and time again. We have one spouse that's got an employer plan. Mm-hmm. Seen a couple kids on Apple Health,
right, which is fine.
And the person staying home, running the household, gets skipped over for insurance.
Mm-hmm. Absolutely, and we see that time and time again.
And this is a way that you can take mom or whoever is at home, taking care of that kids or the property or whatever, can finally get access to health insurance.
Right. And
this is not just hey, you go into the emergency room. Yes, you get emergency services. You get the preventative care. A lot of the plans have co-pays to see doctors.
Yep.
So you've got hospitalization. You've got pharmacy.
Okay, the key element is the out-of-pocket maximum. That is the most important benefit to the ACA plans. The out-of-pocket maximum is the most that you can be billed in a calendar year for all of your medical services. Every copay you pay, every co-insurance you pay, every trip to the pharmacy where you pay for your medications, those dollar amounts chip that dollar amount down. If you get to $0, you're going to be covered 100% by the plan for the rest of the calendar year. If you get bit by a shark, and you spend 3 days in the hospital, you could be in the hole for, $250,000 because, shark bites are expensive. Mm-hmm. If you've got an out-of-pocket maximum, that's the most you're going to pay. And we could be looking at, it could be as high as $9,000. It could be as low as $6,000. Either way, it's a heck of a lot easier to pay that off than $250,000.
Yes. And this program is so big that everyone needs to be talking about it.
Right.
And the reason why I say everyone needs to be talking about it is because if you live in Washington State and you're part of the community, all the community, what happens if you think someone can't pay their hospital bill?
If you can't pay your hospital bill, the hospital pays it. And that means they raise their rates to offset those costs. And that means you pay more for your health insurance.
Yes.
It's a big circle. The more people that have coverage, the better the rates for everybody.
And that is just how it works. It's not a complex. It's like, oh, well, I don't want to pay for someone else. It's like you're part of the community, you're all part of someone else. That's literally how insurance works.
If you say, I don't want to pay for someone else, well, guess what? Every time you go to the doctor, you are paying for someone else.
Yep.
You're paying for somebody who can't afford to pay for their health care. And I'll tell you what, a preventative care visit, a whole lot cheaper than an emergency room visit.
Oh, yeah.
Because if you can stop that heart attack by making sure that a person has the care they need with blood pressure medications or cholesterol medications, or just counseling on how to, exercise and eat better, and not, then maybe they won't have the heart attack and spend 4 days in the hospital.
Oh, yeah.
And rack up a $250,000 bill that they can't pay for.
Yeah, we actually walked into one of our local political parties and yesterday and started seeing on what they knew was occurring, and not a clue.
Oh, that was really
and these are individuals that politics is somewhat of a passion for them. Mm-hmm. Massive change that impacts the entire state
super closely, because if this works well here, the other states will start to adopt it.
Oh, I talked about this is, I think, about 2 years ago. California did let's provide immigrant health care, and they ended up scuttling it. Mm-hmm. Colorado's another one that's been on the forefront of that, because it's the largest block of uninsured. Because if you don't get your health insurance from an employer, you're kind of left to the wolves.
Which is where the ACA started from.
Yeah.
Because if you were not working for the man, if you struck out on your own, yeah, maybe you could go to an insurance company and buy a policy, but boy, was it steep. It was unaffordable. It was unusable.
It was unaffordable. They drop you. That's why they put in the patient bill of rights.
Exactly.
And that was some of the coolest legislation ever, in the fact that it made insurance usable. Mm-hmm. And that's a big change from the dark ages. You had a right to appeal.
Yep.
The insurance companies couldn't drop you if you got diagnosed with something. They couldn't say no if you had pre-existing conditions. Mm-hmm. You could stay on your mom and dad's plan until you were 26.
Otherwise, before that, they were kicking you off at 18.
They were kicking you off whenever they could get a chance.
Well, I'll tell you, just in case you're wondering what life was like before the Affordable Care Act, if you got pregnant, you could lose your insurance just because you were pregnant.
Well, it was something like 80% of the plans offered
didn't offer pregnancy coverage.
Did not offer any sort of maternity care.
Yep.
Prior to the ACA.
Yep.
It creates this kind of dark ages environment of women not being able to get reproductive health care.
And that is a trend that is unfortunately starting to come back stronger than ever. Well,
it is in some states. Other states are benefiting. I know there's been some serious articles written on Idaho on the fact that OBGYNs have been moving out of state to continue their practice because they didn't want that risk. And odds are because they are moving to states that have protected those reproductive rights, like Washington State.
Mm-hmm. And we're neighbors to Idaho, so.
And the problem is the amount of abortive services has dramatically increased in Washington State because of it.
Mm-hmm. Because people are crossing from Idaho to take care of themselves.
Yeah, and so there's going to reach a point where providers are going to have to get together and say, okay, we need to have build more clinics for more services.
Mm-hmm. And some Texas, for example, has laid down laws saying if you are caught traveling across states for abortive services, then you could be arrested.
Okay, they've got sections of highway that they're forbidding women to travel down.
Yeah. Exactly. How crazy is that?
Well, it's not crazy. It's un-American.
It is very un-American.
And
It's restriction of travel.
Yeah, you're literally restricting travel, based on someone, freely moving about the country.
If they just want to go see their sister Louise on a border town, they can't if they're driving. I don't know if they have to be if they're driving by themselves or if they're just driving at all.
Here's the secret. New Mexico is the only bordering state that has any sort of board of services.
Exactly.
So it's the roads leading into New Mexico.
Exactly.
So if I was the New Mexico governor, I would be raising Cain over that.
I hope he is. They are. I honestly don't know who their governor is.
Well, they're actually gaining business from Texas.
Of course they are.
They actually did there was like a $1 billion train station that was supposed to be going through Brownsville in Texas, and they lifted and shifted so that it'd go through New Mexico.
Ooh, clever.
Because Mexico was tired of the poor trade relationships that Texas has been doing.
Yeah, so they're using New Mexico instead.
So they lifted and shifted, and that's billions of dollars of trade. And we're going to see that trend continue of you got to make it easy, you got to make it affordable, and if you're throwing down these fences, you're going to start losing money and resources. And that's just how life works. I mean, I don't know why people thought that that being mean to the downtrodden would benefit them in the long run.
I don't know either, but there is a huge history of that in the world. Stepping on heads to get up your ladder is the thing that's a very common theme in the world by humans. It's a thing. I mean, look at some of the you go back, a few hundred years, look at the French Revolution.
Yeah, and everyone they stepped on the way up, they met on the way
back down. Exactly. But they were having a good old time while they were up there.
Yeah, but those good old times don't last forever.
But when you're in the middle of it, that's not what you're thinking. You're thinking, how can I get my next hit? How can I have the next bit of fun? Oh, and you get this headset that you get this mindset. It's like, oh, it's going to be awesome forever, and not really realize that no, maybe it's not, because you just kind of get in your little bubble, and your little bubble doesn't see the horribleness that made Marie Antoinette say, "Let them eat cake."
Well, there are grasshoppers and ants, and we're kind of into ants. We've been kind of working along at this program for, this will be our 11th enrollment season.
Yeah. It's gonna be a big one. This is gonna be really exciting.
And we're telling everyone, if you want assistance in understanding the changes, to go early.
Yeah, get appointments in now. We are booking already. We're over 100 appointments that are set between Medicare and health and individual health insurance. And there's changes to Medicare too.
So yeah, it's one of those ones. And I don't want to see if you have a retirement plan.
Yeah. If you're just kicking tires for next year, I will see you in January or February.
Yeah.
Probably February.
And the reason why we point blank, if you're planning, plan in January.
Yeah. Don't ask us to answer your retirement. You're planning on retiring in August. Don't ask us to answer your questions during the annual enrollment period. I just don't have time. Well, I will answer questions, just not during this chunk of time.
Yeah, and we've seen this press from retirement plans like PEB and SEB, and if you want answers for those. You've got an office in Olympia.
Talk to them.
If that office in Olympia is not providing the answers,
talk to your legislator.
Talk to your legislators to have them contract with
local brokers or in-person assistors of some sort.
Because you can, point blank, it is a state-run program. You can have legislators say, hey, you need customer service because yeah, if someone walks in here that is looking for that, they're going to get an earful because they're taking space that is dedicated to someone who needs assistance with these enrollment plans.
Exactly.
And it's going to take us a lot more longer for these first time enrollers to get in. Because we're going through multiple documents to get people in. It's either, we've got document one, like a driver's license, a passport and stuff to verify identity. And there's another list of documents that two are required of. Business license is one of those. However, they all have to be verified.
Right.
Because we're not using the social security number to verify identity. As in-person assistors, we have to verify every single one.
Right. We have to look at them and say, oh yeah, this is the person on this identification card.
Yeah.
Yeah. And I'm okay with that. But that means it's an extra step, and we scan the information and we, give it to do we upload it?
I don't think we have to upload
but
it.
But I'm still going to scan it and file it.
We'll have it in our individual files, which is, as I told everyone, it's like, yeah, the minute I walk out of the shop, I'm setting fire to everything.
Everything is secure. There's no, we're always on top of making sure nothing's getting leaked.
We are tight when it comes to information.
It's insurance. We have to be required by law.
Well, we go above and beyond. I mean, we've got like cross-cut shredders. We've got multiple security programs.
Yeah, we've got we are doing everything we can to make sure that your confidential information is confidential. Yes. And as far as I know, we've never had any kind of leaks.
No, not out of this office.
Not out of our office, no. We were actually pretty darn good about it.
Well, it's because we're all paranoid about getting our clients' information. That's one of the big things about our office is we focus on the importance of our clients.
Yeah, they're critical to us.
And
they're our lifeblood.
And the reason why I say this is what really sets us apart is some of these plans that we're talking about, when someone kicks over to Apple Health, we don't get paid a dime for it.
That's right.
The state legislators deem that we are not worthy enough to get paid.
They're wrong, but that's a whole other conversation.
That's wrong, and we complain on a regular basis about it.
And you can complain to your legislators on our behalf. That'd be okay.
That'd be keen. We do it because it is a community service.
We do it because it's the right thing to do.
We don't get paid an hourly wage.
Nope. We are strictly commissioned.
We are strictly commissioned, and we've been that way for over a decade now.
And we're happy with that.
And we are moving forward. So yeah, there are some times where it's like, oh, we would love to be able to go to every event. We don't have the funds for it.
No.
We would love to print out thousands of brochures and have them handed out, but we don't have the funds for that.
No.
And that's what folks need to understand is like, hey, you know what? Even though I'm an enrollment center and I get some money, I don't get any additional funds for immigrant health as of today. Let's see, it's not the in-person assistors, it's the ones above them.
The navigator?
The navigator
lead orgs?
Yeah, the lead orgs. The lead orgs get a budget about 3 times the amount we get. Because they're running people and they're more armed for outreach. But the navigators are all, they're hourly paid.
Yep. So, I mean, that's a good place to stop, I suppose.
It is. That is some of the little secrets about it. If you start talking, you're going to find, we uncovered dreamers and people who did not know that they were not here legally for years. We've uncovered people like that.
Yeah. And because their folks never told them that they weren't born in the United States.
Or they gave them a cooked up birth certificate.
Yeah, that happens too.
We've seen that too. So yeah, start talking about immigrant health care, and that the fact November 1st is the moment it starts enrolling. if you are an immigrant or your spouse an immigrant or you know someone in that status, have them set the appointment early.
Yep.
I cannot stress that enough. Set the appointment early. That is critical to get in, get your stuff taken care of, and that way January 1st, you've got health insurance.
That's right. All right. Well, thanks for joining us today on Suzilla. We will talk again next week.
Yes. Bye-bye for now.
Bye.